Hi, Dr. Games. Hope your week is going well. This will serve as my video for reflecting on my spine evaluation. I was a bit disappointed in myself when I did reflect, but I can't say that I'm surprised. I would have to rank myself probably at like a 3. And I think that's for a variety of reasons. I think one is that I don't have a lot of confidence in myself as a clinician, and I think that that's due a lot to me just being very new. So I think that regardless of whatever body part it is, I would probably rank myself really low. But in all seriousness, I do think that I just have not had a lot of opportunities to see a lot of spine issues. I've never had an emergency C-spine scenario. I've never had an athlete. I've never worked an upper body, well, upper extremity sport, really. Not a primary upper extremity sport, where I was able to kind of evaluate movement, that kind of thing. I've seen a lot of lumbar because I did work football. And so I feel more confident in lumbar than I do in any other region, and I think it's just because I've had more exposure to it. And I think that treating lumbar is completely different than treating thoracic. And which brings me to your second point, which was your strengths and weaknesses. So lumbar's got to probably be my strength, only because, like I said, I've had experience with it. And when I look at my evaluation process, I think that the strength in that is that I look at so much more than just the back. The lumbar area is very, very connected to a lot of lower extremity pathologies. So one of the top things that I always do, no matter what they're presenting with, is check their hips. A lot of the times, a pelvic malalignment, or just dyskinesis a little bit in that area can really hinder the back, and it's not actually the back that's the issue as much as it is the hips. So a lot of my evaluations of the spine begin with the hips. And then from there, that's where kind of my weakness lies. I have a weakness in special tests because I, again, haven't really had an opportunity to really utilize them. I've learned about them, of course, in undergrad, but utilizing them is a different story. In my mind, there's a lot of neck bending and torso bending and straight leg raises, and it all kind of tells you nothing in my mind. And it's just, I think, because I don't have a lot of confidence in them. I think special tests is definitely a big weakness of mine. I am quick to just assume, just have my patient do Valsalva, and if they complain of shooting pains on the leg or any type of shooting pain in the butt region, I automatically think sciatic nerve involvement, and that takes me back to the hips. And I like the hips. So it's just funny to me that a lot of my, especially lumbar, spine evaluation ends up being more like a hip evaluation. So those are definitely my strengths and my weaknesses. I think also with a weakness is centralization. I have heard of the concept, and then again, when I read the articles today, they really reminded me of its importance. And I just don't use centralization. And I think that that's a huge concept that does not need to be overlooked. And I think I'm so quick. I do check range of motion. I do flexion, extension, side bending, rotation, and I like to see where the pain, or like what causes pain, but I'm very quick to just assume pain is everywhere. And I forget that during that flexion, they might be able to point to one finger where it's at. And so that's a big concept that is really going to affect how I carry on my evaluation. And the fact that I don't do that is, I think I'm missing a lot. Areas of improvement kind of go with my SMART goals, of course. I think that areas of improvement are the thoracic area in general. I think that I don't have a lot of ideas of lack of movement in that area. I see a lot of upper extremity sports working on that, especially one-sided sports, and I often forget that that's actually important. So I think that that's some things I want to improve on, as well as, of course, centralization and cervical neck or cervical spine. I feel like I can handle an emergency situation with cervical spine, but I think I'm very weak in like joint mobs in that area, for instance. And that actually reminds me of another weakness that I noticed when I was going through my evaluation and when I was reading those articles. They talked about hypomobile and hypermobile joints, and I don't think I've ever tested the spine for that. I mean, it's so easy to test the extremities for a lot of movement or little movement or laxity or instability, but it is not easy for me to do that in the spine, especially when I'm already bad at palpating the spine because all of them are very close and it takes me a long time to kind of figure out where I am. But also when you add to that trying to feel movement and figuring out, is it the hypermobile joint that's affecting it, or is it because the joint below it's hypomobile, or is it both? So I think that is a main area that I want to improve on, is being able to understand, which is a really bad objective term, so not be able to like demonstrate that I am proficient at feeling hyper and hypomobile joints, as well as the treatment for that. Don't know what I would do if I ever had an athlete come in with that. I think I don't know what I would do. Have to do some research, just because I just haven't had a lot of experience. So SMART goals or things I want to improve on is a lot. I want to improve on everything, but I think mainly is being able to demonstrate by the end of the semester my ability to palpate a hypo and hypermobile joint of the spine, as well as work on joint mobs in those areas, which they kind of go hand in hand, because if it's hypomobile, you're obviously going to need to do joint mobs. If they're hypermobile, not so much. And then being able to treat those types of conditions. I think so that's what I want to do by the end of the semester, and something I want to be able to incorporate into my standardized patient. I definitely want to be able to utilize the concept of centralization by asking more frequently about where the pain is or if the pain is moved, and not doing it so when they flex over, not doing it after they stand up, like, did that hurt? Where did that hurt? But doing it during. So they're down in flexion and you're saying, please point to where that hurts, because it might centralize when you're in that flex position, but when they come back up, they're not in that position anymore, and so it's back to being changed. So I think that that's something that I can definitely improve on. So demonstrate or utilize the concept of centralization in my standardized patient by asking questions during movement, and I think that's really important. 3, I would like to utilize at least 3 special tests in at least one patient by the end of the semester for the spine. And whether that be all the ones I don't know, bowstring test or Gainslands or something, where ones that I've learned about and then forgotten, or learned about and don't find valuable when they really are. And demonstrate the ability to palpate a hypo and hypermobile joint, which I've already touched on. So I had them written down, so I went a little bit out of order. But those are my main SMART goals. I want to do, like I said, the special tests before the semester ends, because that's really going to help benefit my patients. And I want to be able to look at movement and especially focus on centralization in my standardized patient by asking questions during that movement. So that's something that I can practice in my clinical setting right now, and hopefully be able to utilize confidently in my standardized patient. So I have a lot to learn. I'm very excited. Looking forward to growing as a clinician, but I have a long way to go. So, if anything, that's what I've learned today. Thank you, Dr. Games, and I'm sure I will be seeing you very soon.